My name is Dr. Thomas Infernuso at the Animal Surgical Center. The topic for this week is total ear canal ablation. What that is just removal of the entire ear canal in patients that have ear tumors or chronic ear infections in which medical therapy has failed. So what the surgery entails is exactly removing the entire ear canal by shelling out that cone, like an ice cream cone, where the portion of the canal is completely obliterated or completely closed off from tumors or just thickening of the ear secondary to this yeast or bacterial infection. So the surgery is very successful, is done, and most often they go home the following day. We use a special drain to drain all that pus after cleaning the base of the ear. And there is a misconception in regards to clinical signs. A lot of people say, well, if you do this type of surgery, is the patient is going to lose the ability to hear? And we tell them, unfortunately, no, they actually feel better. Why? Because the portion, the middle inner portion of the ear is not damaged. So the sounds that go through that portion of the ear canal, which is called the external ear canal, it's going to be muffled. It's like you're putting a palm on your ear. You're going to still hear it, the sounds, but you're not going to be able to hear it very clearly. So in regards to hearing, they're going to be able to hear. Number two, as far as the complications that are associated with this type of surgery, you have what we call the facial nerve palsy, which basically means that the nerve that runs right behind the ear can potentially be inflamed. If it gets inflamed, the ability to blink is going to be diminished. Sometimes they have a little lip droop, so they salivate because the ability to move that lip is going to be diminished. But most often resolves over, I would say, roughly a couple of weeks if the nerve gets inflamed. And then the last thing, as everybody knows, the ear is important of balance, controlling the balance. So if there is inflammation, it might have a little vertigo, but most often resolves within weeks. So overall, the success of surgery is very high. We strongly recommend it in patients that fail the medical treatment. It was a pleasure. My name is Dr. Thomas Infernuso. Please follow us on Facebook and Instagram, and have a great week.